Bismillahirrahmanirrahim. Today we are gonna discuss the cervical plexus, which is in line with that of brachial plexus and similar to it and that of the lumbar and the sacral plexus. So let's see how it is formed. It is formed by the anterior primary rami of the cervical spinal nerves, that is from C1 to C4. These are making the roots of the cervical plexus. Now this cervical plexus is supposed to form the series of the primary nerve roots and the branches that arise from these loops. Now what is going to happen that except the C1, which is not going to divide, rest of it roots are going to divide into ascending branches and the descending branches, and then reunite with the branches of the contiguous or adjacent spinal nerve to form the loops. These loops are called as, again I am repeating, the primary nerve loops. This cervical plexus is located anteromedial to the levator scapulae and the middle scalene muscles, and you can say that it lies deep to the sternocleidomastoid. The bunch you are looking into are the branches of the cervical plexus here. As the cervical plexus is located in the posterior triangle of the neck, it has to provide nerves to your head, neck and shoulder as well. And it lies within the prevertebral layer of the cervical fascia. Now you can see that from where it emerges around the middle of the posterior border of the sternocleidomastoid, and you call it as the nerve point of the neck. I'm going to show you the point which is marked with the black line called the nerve point of your neck. Now you are looking into a picture of the schematic diagram in which you can see the looped structure of the cervical plexus and the nerve branches that are marked in green color are its lateral branches, and these are basically superficial, sensory, and are going to supply the skin of the respected region like head, neck and a little part of the shoulder you can mention. So the thing that covers the lateral aspect are superficial, sensory and to the skin or to the cutaneous area, you would say. So 3S you would remember for the nerves located laterally. And the nerves you are looking to the lighter shade, whitish shade, these are the location of the nerve of cervical plexus which are deep, and they are present medially or anteromedial in location. They are motor to the muscles, so it means medial, motor and muscular. So definitely 3M depicts their location in the deeper region, easy to remember or cram. Now look into the first the cutaneous branches of the cervical plexus, which are definitely sensory. Now you can see the names of them. Number 1, you can see the lesser occipital that derives its root value from the C2. It supplies the skin of the neck and scalp, posterior and a little bit superior to the auricle. Then you can see the great auricular nerve with the root value of C2 and C3 that supplies skin over the area or a sheet surrounding the, you would say, parotid gland, mastoid process, and skin extending from the angle of the mandible to the mastoid process. Then you see the third nerve, which is the transverse cervical nerve, root value again C2 and C3. What it does, it has to divide into superior inferior branches, and it supplies the skin covering the anterior cervical region. Now focus on to the supraclavicular nerve, root value again. Now you can see here are the C3 and C4 now this time. They are going to divide into 3 small branches. The medial supraclavicular the intermediate supraclavicular, and the lateral or posterior supraclavicular. And they are going to supply the skin of the neck that crosses the clavicle and supply the skin over your shoulder as well. Again, a picture, you can see the four these sensory nerves with their root values. Now a bit more about it. Now you can see that there is a superior root of the ansa cervicalis, which comes from the spinal nerve C1, the fibers of C1 and the C2. You can see they briefly join each other and then ascends along with that of the hypoglossal nerve, and then descends from that very hypoglossal nerve and traverses your lateral cervical region. Now you can see there is the inferior root of ansa cervicalis that arises from the loop between spinal nerve C2 and C3. The superior and the inferior roots, they unite to form the secondary loop of this ansa called the ansa cervicalis. So they take contribution from the C1, C2 and C3 spinal nerves, and with the branches from the secondary loop, they are gonna supply where the infrahyoid muscles including the omohyoid, sternothyroid and sternohyoid. And there is another fourth muscle left, you will recall, that is a thyroid, that receives basically branches from the C1 and descends independently from the hypoglossal nerve and distal to the superior root of the ansa cervicalis, or you can call it as nerve to the thyroid. This cervical plexus close to its origin near the nerve point. The roots of the cervical plexus gonna receive gray rami communicantes coming from the superior cervical sympathetic ganglion, and this sympathetic ganglion branches are communicating branches, one of the communicating branches. In addition to these sympathetic branches, it also communicates with the branches with the hypoglossal nerve, the vagus nerve as well. So how will you remember them? You can make a mnemonic of this hypoglossal, vagus and sympathetic in a term to say how very sympathetic, means HVS, so they communicate. So remember the mnemonics for communicating branches, the H, V and S. Now you can see the motor branches being medially, and they are to supply the muscles. And here these are the muscles which are solely supplied by cervical plexus. You can see here, number one, the rectus capitis anterior and the rectus capitis lateralis and the longus capitis, and you can see that the lower root of the ansa cervicalis, which another name is given here, the descendens cervicalis, and the name of the superior root of the ansa cervicalis is the descendens hypoglossae as well as because you should know the other name if you can come across these terms as well. Now you can remember the muscles being supplied by the cervical plexus along with that of the brachial plexus or the spinal accessory nerve, which is the cranial nerve. I have to mention the muscles. These are the sternocleidomastoid from C2 along with accessory nerve, and the trapezius from C3-4 and with the accessory supply as well. Then you can mention the name of the muscles like levator scapulae from C3 and C4 with C5, and you can recall the dorsal scapular nerve. And then you can see the formation here of the phrenic nerve coming from the roots C3, C4 and C5. Then you can recall the muscle, the scalenus medius, the scalenus anterior and the scalenus posterior. So it means that the prevertebral muscles and the infrahyoid muscles and the muscles of your neck are also part of it, and like trapezius and sternocleidomastoid, the major muscles, are also a part of its spine. Now look into a picture I have taken just to show you the phrenic nerve that is originating from the C3, C4 and C5, and you see it is descending downwards, and it has to read downwards up to your diaphragm, because it has to supply the diaphragm as being the motor, the sensory, and it also has sympathetic fibers in it also. Now in this very picture you are looking into ansa cervicalis, its root value, that what inferior root is made up of and what the superior root is made up of, and being display to that omohyoid muscle, its superior and inferior belly is shown here. And in this picture you are looking into the cutaneous nerve with their root value, that the yellow color is showing the contribution of the C2 in the upper 3, and the green color showing the contribution of C3 in this lower 3, you would say, and the contribution from the C4 in the blue color as well.